with change that works here in Jonesboro. And the first thing I want to do is thank you guys so much for coming out. I see a lot of familiar faces, but more importantly, I see a lot of faces that we haven't seen yet that are interested in healthcare reform and learning more about it. So first of all, thank you guys so much for coming out. How about our own applause for you guys? The other thing I want to mention is kind of what we're doing here. So obviously today is a chance for us to introduce ourselves, let you know exactly what we want in healthcare reform and what's going to be important for the people here in Jonesboro with healthcare reform. But also about what we're going to be doing with how we get our local congressmen and senators and representatives to vote for it. So one of the things we're doing is we're writing letters, making phone calls. If you guys came in, you probably saw the postings on the other room, on the other side of this office here. So if you guys get a chance, please do write some letters, make some phone calls talking about Senator Lincoln. Because Wednesday for our rally at noon, by the way, so another thing I want to say, we're going to be outside of her office, kind of doing a bunch of sign waving and hooting and hollering. The other thing we're going to do is we're going to deliver the letters. Thank you, Catherine. Deliver the letters that we write today to show her why we support healthcare reform and why she should continue to support it. The other thing we're going to do is drop off this declaration for affordable healthcare, which I think a lot of you have signed, but if you haven't been able to sign it yet, please do on the way out. So those are the things we're doing. Again, Wednesday at noon, please join us outside of Senator Lincoln's office, Federal Building downtown. It's going to be a good time, a lot of fun. Hopefully not as hot as it is today. But without further ado, I don't want to take your guys' time, too much of your time, because I know you're enjoying the food. So without further ado, I'd like to introduce Norman Stafford, who's somebody who cares deeply about healthcare reform, and he's going to talk about why he does.
Thank you very much. And if I look back there with these large signs, I should have made a deal with you and made my life a little easier. Today, in the guest editorial in The Sun, a local pharmacist, Brandon Cooper, tells of abuses in the present healthcare system, of hidden profits that accrue to drug companies under Part D at the expense of the health benefit. Some of you may have read it, but for those who haven't, I urge you to do so. However, I have an example that hits closer to home, and the cost was not hidden. The example concerns someone whose situation I know well, and from my perspective, the exorbitant cost should not have occurred at all. This woman suffers from arthritis, and her physician prescribed Celebrax, a drug I'm sure most of you have heard of. But perhaps you're unaware of one of the virtues of Celebrax is that it can be used by people who take blood thinners. The problem resulted when the administrators of her Part D plan insisted that the woman use a less expensive drug instead. She pointed out that her physician, a specialist and an expert in the field, has specifically stated that the less expensive drugs were unsuitable, in fact dangerous for anyone on blood thinners. The woman pleaded with the supervisor, who was unmoved, and so her Part D plan would not pay for the Celebrax, roughly $150 a month. Were that the only drug that the woman were taking, she may have paid the high cost. But like many of us, she's taking several prescription drugs. The upshot is the woman is taking no pain medication and is suffering pain she should not have to bear. I find this situation unjust, unacceptable, and intolerable. We all like to say that the United States is the richest nation in the world, but clearly our healthcare system provides an ironic contrast to that claim. Even more potentially catastrophic problems exist for those who, unlike the woman in my example, have no health insurance coverage. This is the situation for roughly 1/4 of the residents in our district, the 1st Congressional District. 24%, not to be specific. Think about that. 1 out of every 4 is uninsured. An example of this problem. Just yesterday, a friend of mine had surgery on broken bones in his lower arm and wrist, an injury he incurred while playing softball in church league. While running to first base, he tripped over his own feet. Well, that happens when people my age play softball. And his right hand bore the full weight. Several bones were literally shattered. He was taken to an emergency room here in Jonesboro, but when he revealed that he was uninsured, the physician refused to treat him. Oh. Because he was a veteran, my friend was told he could go to a VA hospital, the nearest one in Memphis. His injury occurred a week ago Tuesday. It was 11 days. Yet he was operated on yesterday, not at a local hospital, and not without undue suffering. This treatment is also unjust, and from my perspective, immoral. I could cite many other examples, and I'm certain that many of you present today could as well. These problems don't exist just in Jonesboro, or just in the 1st Congressional District in Arkansas, or just in Arkansas. They exist across the United States, and we should all be ashamed of that. It should not exist anywhere in this country. Lyndon Johnson's favorite philosopher, Eric Hoffer, said a country should be judged not by how well it treats its wealthiest citizens, but instead by how well it treats the poorest in its society. We need to heed Hoffer's words. We need to reform our healthcare system. Now is the time for this change, and if not now, when?
You're here. All right.
Thank you, Norman. And I want to give you guys a chance to get back to the cookout. But before we do, if Patty, I know Patty has worked for a lot of her life in the healthcare industry, and she's heard a lot of stories about, why we do need healthcare reform. And if you don't mind, Patty, if you don't mind sharing a couple of those, that'd be great.